Good news to all PCOS women. Weight reduction medicine is finally here. To the millions of PCOS women out there, I would like to guarantee you that your life is going to change drastically if you make the changes that I would recommend in this video. Hi, I'm Dr. Anita, IVF specialist and laparoscopic surgeon. We have a team of PCOS specialists here in our unit at Cochin, Kerala. Kerala is also known as the God's own country, and it is in South India. Polycystic ovarian syndrome, PCOS or PCOD are all one and same condition. It's a genetic condition and it is a lifelong condition. The main problems with the PCOS is that the level of hormones are abnormal. There are three important factors in PCOS. The first one is that the male hormone called testosterone is very high in the females with PCOS. The second problem is that the insulin resistance, just like in diabetes, is a big issue in PCOS. And the third problem is that the hormone abnormalities result in anovulation, that means there's no ovulation, and this results in irregular periods and sometimes subfertility. The high levels of male hormone called testosterone results in a lot of problems in PCOS, especially on the skin. The excess facial and body hair and acne is due to the high testosterone. The other issue with high testosterone are the psychological symptoms like irritability, mood swings, anxiety, depression, social isolation, eating disorders, lethargy, sleeping disorders, and sometimes even suicidal tendency. Now, the second problem, which is the insulin resistance, is also going to result in lot of long-term problems like metabolic syndromes. That is high chances of diabetes, especially in pregnancy, high chances of hypertension, high cholesterol, cardiovascular problems, weight gain, etc., etc. The third problem, which is the irregular period, which is a result of not having ovulation properly, results in subfertility in some women. The management of polycystic ovarian syndrome involves several factors. One is medications, especially medications with insulin sensitizers. The other one is medical procedures like laparoscopic ovarian drilling and infertility treatments like IVF and ICSI. The most and relevant information that I want to give you is that you can make a lot of changes in your life. That is, lifestyle changes will have 2/3 effect on your PCOS. Only 1/3 effect of the PCOS management is from the medical and surgical side. And what does that involve? Lifestyle changes will involve a change in your diet, regular exercise, proper sleep hygiene, and your stress management. When it comes to diet, you need to reduce the level of carbohydrate in your diet. That means you need to reduce the amount of rice, wheat products that you have in your diet. You need to have a balanced diet. Increase the amount of protein and have a lot of fiber in the form of vegetables and fruits. Cut down on fast foods and processed foods. Try and avoid or stop completely taking sugary items and bakery foods. So you need to actually reduce or stop having cakes, biscuits, fast foods, etc., etc. When it comes to exercise, you can choose any form of exercise that you like. There's no set pattern to it. The only thing is that you need to develop a habit of having it regularly, at least 1 hour, 5 to 6 times a day. That will make a huge difference in your lifestyle, especially your personality will change, because exercise have actually proven to reduce the amount of testosterone and thus control all your psychological symptoms. And the next important aspect is managing your stress. PCOS women are known to have a lot of mood variations and irritability and anxiety, depression, etc. Having regular counseling and adopting a lot of measures to manage your stress will help with your disease. We never knew that sleep had such an important role in PCOS till recently. The same problem in the morning, they have difficulty in waking up. So if you adopt a sleep hygiene measure where you relax completely, avoid things like computer, TV and phones at night, and maybe have some melatonin tablets to make your circadian rhythm correct. And try and do a lot of exercises and relaxing, stretching things before you sleep. Diet, exercise, stress management, sleep, etc., etc. Easier said than done, right? It's very difficult to actually do all these things. So that is where cognitive behavioral therapy comes. So I'll just explain how it is all done, the management. First of all, a proper counseling by a specialized person is very important to teach the patient and her partner and her family about PCOS. So what we do here in our center is that we have a proper team with a gynecologist, the counselor, the dietitian, physical trainer, etc., etc. So we give them counseling, which is like half an hour to 1 hour in a regular interval, and we give them a leaflet explaining what the disorder is. We also give them a diary. This is PCOS diary. This has all the information that we give them normally, and it also have columns to enter the health parameters like weight, blood pressure, sugar, waist circumferences, etc., etc. for nearly 20 years. You can record your periods also for 20 years in this diary. So this will help you to decide what kind of management is best for you, and it will also act as a health record. So this diary is given to every single patient after counseling. And an important step in PCOS management is finding out the actual scale of the disease, because you have different types of PCOS and phenotypes. So for that, we have made a scale in our center. In the scale, we are measuring weight, height, visceral fat, period regularity, acne, excess hirsutism scale, hair loss, acanthosis, psychological symptoms like mood variations, irritability, poor body image, social isolation, anxiety, depression, eating disorder, sleeping disorder, lethargy, etc., etc., like a score, so that we actually get a score in each symptom, so that we can treat patient individually. There is also a checklist in which we make sure that everything is done completely and properly for women. The checklist, it includes the scanning, the counseling, the diary that we give, the YouTube links that we send to the patient. It also includes the consultations with the dietitian, physical trainer, and the list of medications like insulin sensitizers, vitamins like vitamin D, and sometimes rarely if we do have to give hormones, we try to avoid hormones as much as possible, because we want to manage PCOS without hormones, because this is a lifelong condition. And if they do have issues with subfertility, it is an entirely different field, and then they get a record for infertility as well. Sometimes the patients require cosmetic treatment in spite of all these management. So the checklist also includes cosmetic management like laser for acne, hair removal, and then PRP for hair loss, and sometimes the patients even require laparoscopic ovarian drilling. Laparoscopic ovarian drilling is usually done for patients with subfertility, or sometimes patients have repeated miscarriages, they don't get pregnant for many years, and they might even require IVF. And as I said earlier, it is a team effort. Only if you have a proper team, then the management of PCOS is successful. And as I said, it is very difficult to actually inculcate these habits about the healthy diet and exercise. So regular counseling and regular meeting, even if it is online, it is very important to keep the patient motivated and to make sure that patient stays healthy. There are lean PCOS women. That means you could be thin also. But for women who are overweight or obese with PCOS, as I said, good news is here. We have new medications which have been approved for PCOS. They are effective in reducing the weight and also in controlling the symptoms and even infertility. Sometimes women with PCOS also have sexual dysfunctions, and now with cosmetic gynecology we have new treatments in the form of Botox injections for women who have vaginismus, that is painful relations. If you have PCOS and if you are unable to get help, we are more than happy to help you. You can contact us from anywhere in the world, either through email or online consultation. We are happy to help you.